Hello everyone. Today I will discuss on the remaining topic on neurodevelopmental disorder, and those are specific learning disabilities which comprises of dyslexia, dyscalculia and dysgraphia. After this I'll talk on tics and Tourette syndrome, which are the involuntary movements or the vocalizations. Starting with the key features of specific learning disabilities. So the key features, number 1, children having specific learning disabilities, they have normal intelligence. Their IQ level is average or even above average. In these children, a specific learning area is affected while all the other activities are remaining normal. So in that specific portion, this child will be performing at a below average level or below intelligence level in that specific area. And always remember, this defect is lifelong conditions, they persist for life, but with time the severity may vary. Come to etiology of these specific learning abilities. Number 1 cause, CNS dysfunction. So mainly occurring in the temporoparieto-occipital region of the brain. And these children have processing impairment. There is difficulty in perceiving, thinking and remembering and learning part. So those processes are impaired. And this is having some genetic predisposition, because if a sibling has specific learning disabilities and abilities, the chances for the child to have SLD is 40%. So there is a strong genetic predisposition. And there are certain conditions which may be associated, or in these conditions like fecal alcohol syndrome, lead poisoning, Fragile X syndrome, may have some sort of learning disabilities. So it may be associated with disease at times. And other risk factors will be prenatal or perinatal factors like prematurity, low birth weight babies, intraventricular hemorrhage or intrauterine infections. So all these conditions may lead to some sort of CNS dysfunction affecting the temporoparieto-occipital region, leading to specific learning disabilities. Let's discuss the common types. So there are 3 common types. Dyslexia, this is a reading disorder. Dyscalculia, that is mathematic disorder. Dysgraphia, that is a writing disorder. We'll start with dyslexia, and which is the most common. So dyslexia is the most common specific learning disabilities. Dyslexia runs in the family. It is inherited, and in this there is impairment in the brain's ability to translate the written images received from eyes into a meaningful language. So something a child sees from the eyes cannot translate into the language. So from the book, if the child sees some words, languages, or in even the pictures, the child cannot describe that in language. So there will be a severe reading disability in these children, which will be much less than the expected level for age. So their reading ability will be very bad. Now there are certain early clues which will help you to say or to come to a diagnosis of dyslexia. So even the parents, if you find these clues, you have to consult the doctor immediately if you find the following points in your child. So dyslexia is usually diagnosed when a formal reading instruction starts, that is at around grade 1. If your child is having delayed speech, if there is an incomplete interpretation of speech, if the child is confused about right and left-handedness, up and down, early and late, yesterday and tomorrow, months and days, and if your child is having problem with new words, if there is an inability to recognize words and letters on a printed page, then you have to consult the doctor. So these are the early clues which will help you to come to a diagnosis of dyslexia. Now come to the clinical features. So a child having dyslexia will have a severe reading disability, difficulty in reading. There are challenges with decoding words. Now decoding words means sounding out written words so you can understand and read them. Like example, suppose cat, cat, cat. This is decoded into fractions like C, then A, then T, and the child recognizes the letter that way. So decode the cat word into C, A, T and let the child pronounce. So you have to help the child this way. So they have a problem in decoding the word. So if you cannot decode the word, you cannot read fluently. So these children have another clinical features are they have difficulty writing. They struggle with writing expressions because whatever they see they cannot express that. They have a expressing problem. Number 3 is speaking difficulty. Their speech may be impacted. So speech impacted means a person's ability to speak clearly, fluently is severely impaired. So this child cannot speak or read fluently. So this is another problem they have. Another clinical feature is in the reading. Whether to read right to left or left to right, they get confused. Another is difficulty remembering or expressing the information. If they read also, they cannot express. And another is they get confused or there is word and letter reversals, like getting confusion with B for D. So they instead of writing B, they write D. Instead of writing SAW saw, they might write WAS was. And they get confused with number and letter sequence also. For 12, they write 21. So similar numbers, they are getting confused. 16, 61. So that way they are getting confused with the words and letters. So if your child is having these clinical features, then you have to suspect dyslexia. The problems with dyslexia is they cannot follow rapid instructions and they cannot follow more than one command at a time. So you have to go very slow and give a slow command to these children. They have very bad reading comprehension. So this means they forget what was just read. So they cannot recall. Another is they can read words but they do not understand what they are reading. They do not understand the meaning. Another is they cannot summarize what was read. So this problem they have. Another is difficulty in expressing thoughts in written form or written words. Next topic is dyscalculia. This is a mathematical disorder. Here there is a problem performing accurate and fluent calculations. So amongst the specific learning disorders, 20% is constituted by dyscalculia. And dyscalculia is usually diagnosed at around grade 2 or 3 where the children starts calculating or doing the mathematics. Another problem is dysgraphia. So this is a writing disorder. Here there is a disorder of written expression. They cannot express the thoughts in written form. So when they try to write, there is difficulty to compose any written text. They start making grammatical errors within the sentences. There is poor paragraph organization. They cannot organize the paragraph properly. And you can see there is a multiple spelling errors in the same word or sentences. And then they have a very excessively bad or poor handwriting. If they have a dysgraphia. Okay, there are some other conditions which might coexist with a specific learning disorder, and these are ADHD, that is the most common, then autistic spectrum disorder, communication disorder, mood disorder, anxiety disorder, the enuresis, tic disorder and social phobia. So in all these conditions, the specific learning disorder may be coexisting. Now come to diagnosis. So this learning disorder is only diagnosed if a child gets opportunity to learn or go to school. Otherwise, usually if the child is not going to school or not learning, then many times it remains undiagnosed and child is having other activities very normal, so you will not diagnose. If a child is getting learning opportunity, then only this condition is diagnosed. So to diagnose this condition, if one individual, the individually administered standardized test is there in reading, mathematics and written expressions. So all this, if it is falling under under 2 standard deviation than the expected for the age, schooling and level of intelligence, then you can say this child is having specific learning disability. So you have to compare with the normal schooling or normal intelligence level for that age. If that task is reading, mathematics or the written expressions, if that is falling below 2 standard deviation than the expected for that age and schooling level, then you will say this child is having the specific learning disabilities. Screening and diagnosis. Actually, there are no single test to diagnose this is dyslexia, this is dyscalculia or dysgraphia, but you have to evaluate by including several points. So the evaluation involves these following 5 points. Here, start with the medical evaluation. Here you assess the overall health and neurological factors. Then you can see the cognitive assessment you can do. Here you evaluate the intellectual abilities and processing skills. The intellectual abilities means you will check the memory, attention, concentration, how much this child can focus, or how much this child is able to solve the problems like solving the puzzle, and then check for the verbal ability, that is reading, speaking, writing or calculating. So this will all come under intellectual abilities. You have to test all these things. Then you check the processing skills of this child. So processing skill means the mental abilities of the brain. So here, after following the spoken instruction, how the child can follow your instruction. Another is visual processing, and another is reading capabilities or copying the shapes or letters from the books. Another is just try and then tell them some phone number and see how much this child can remember this phone number in the head. So all these are occurring under the processing skills. It is showing the brain's ability of mental functioning. So this you have to evaluate in a cognitive assessment. Then you can do the sensory processing. Here examine the visual, auditory and other sensory functions of the child. Then go with the educational factors. You just go to school and see the academic record of the child, academic history, the learning opportunities or how the child is doing. And then another psychological aspects also you can check, evaluate by here you consider the emotional and behavioral influences in the child. So by this thorough evaluation you can come to a conclusion of a specific learning disabilities diagnosis. Now come to the tools, and we can use some tools to diagnose these conditions. So there are a few tools which are commonly used, and all these tools are actually used to measure the child's academic skills and abilities and see whether it is below or above expected level for their grades or for their age. So the academic strength and the weakness is seen by all these tools. So number 1 tool is known as GLAD, that is Grade Level Assessment Device for Children. Number 2 is NIMHANS Index for specific learning disabilities. So here very detailed reading, writing, spelling and arithmetic abilities are seen in more detail. And then these two are commonly used in the developing countries, and throughout the world they use other tools also known as Woodcock-Johnson tests of achievement. So mainly academic evaluation is done over here. Wechsler individual achievement test, that is WAIT. Here also academic evaluation is done. So by using these tools also you can come to a diagnosis. Now the treatment approach. There are no cure. So number one you have to understand and you have to know is there is no cure for the specific learning disabilities that will stay with you throughout life. There is no way to correct the underlying brain malfunction. So to manage this, there is multidisciplinary and individualized approach, which is individualized to each child's needs. So for each individual child, the approach will be different and different field of help will be required for different children depending upon how they are manifesting clinically. Then multi-sensory learning is used. Here techniques involving hearing, vision and touch which enhance the skill of reading is used. And frequent instruction by reading specialists can be done to improve the reading of this child. And severe reading disability, if a child is having severe learning disability, then you can make small group sessions, and then each week in a small session, group session, you can help the child to improve reading. Another way of helping or another way of management is special education. So here individualized education program is used, which is also known as IEP. This comprises of 3 points, that is phoneme awareness, phonics instruction and building on writing skills. So number one, phoneme awareness. So this means exercise of reading by segmenting words into smaller sound units to improve the reading. You do this. So in the phoneme awareness, phoneme means it is a smallest unit of sound in a word. So like suppose the word cat is there, then this has 3 phonemes, C-A-T. So this is the smallest unit that is used. Okay, so three phonemes are there. So this phoneme you divide and then help the child to pronounce that, like cat, that way they'll say cat. So this is the number one practice you do. This done by the specialized teacher in the specific class. And number two is phonics instruction you can do. So this links individual sounds or that phonemes to a specific letters and words. So you just repeat that and help the child to pronounce. Another is building on writing skills. So this builds on foundational writing skills and imparts the essential number sense. So foundational writing skills means the basic ability of writing. Like they help you how to grip the pen first physically, then the letter foundation they will teach you, then they will help you to improve your handwriting by using specific notebooks or specific lined notebooks you can use. Then spelling check they can do. Then they will help you to phrase the sentences, help you with how to structure the grammars. So these are all coming under the foundational writing skills. So this way this child is going to have a special class with a special teacher, and then individualized education can be done to individual child. So how much this child is requiring. So individual child may require individual degree of help. So that way the special education can be done to manage these conditions. Then there are other interventions, specific interventions. One is known as remediation. This is used especially for the younger children. Here there is intensive instruction from trained teachers on special reading programs, and another is done for the older children, that is accommodations. Here you give, these children will receive extra time to complete the task. So you can use laptops, computers for these children where they can do spelling check. Tape recorders you can do, they can hear and then utter it out, because after looking they cannot read. So you can use the tape recorders of the same task, and you can help the child to express themselves. And then you can also even use recorded books. The same written books, you can make it available in the recorded forms, and then listening to that recorded books, this child is going to learn. So that way, with a special intervention, this child can improve, or this child can follow the classes. Now come to the summary of the specific learning disabilities. So in summary, these are common problem, and amongst this dyslexia is commonest. But many times if the child is not getting opportunity to learn, and this it goes undiagnosed, but the child is living a normal life. This will manifest as in the initial step as language delay. They have a poor vocabulary, child is having spelling mistakes, they have problem or confusion with the specific words, and they are unable to read whatever they see in the books, and they have a bad handwriting, and they cannot express in the writings, and they have calculation problems. So with all these clues, you can say this child may be having the specific learning disabilities. So children having specific learning disabilities, they should be taught in a regular school. They can go to normal school, they do not require a special school, but here you have to do the individualized education, or they need individualized attention. And another point is specific learning disabilities, it does not go away, it will stay with you throughout life, but a person will learn to manage it as the time passes by. Another is reading. Throughout life, this person is going to have reading problem, so reading remains effortful, but they read slowly, and then they do make spelling mistakes, but their ability to learn and then to reduce the spelling mistakes they can do, and then expressions and reading gradually they can improve dramatically if they get help with the special interventions. Remediation and accommodation are the cornerstones of management, so you have to help them with these two main management points. Okay, if you have dyslexia, you don't have to worry, because there are many great peoples, renowned people who had dyslexia, but they had a very successful life. So here there are some examples of the very great people. So political leaders, they like Thomas Jefferson, John K. Kennedy, George Washington, all these people had dyslexia, yet they had a very successful life. Musician John Lennon, such a famous musician, but he had a dyslexia. And then Law and Justice Erin Brockovich also had dyslexia. And many filmmakers or actors, they have dyslexia, like Walt Disney, Tom Cruise, Harrison Ford, Whoopi Goldberg, Jay Leno, Robin Williams, Abhishek Bachchan, all these people, great people, they had dyslexia. And inventor or scientists like Thomas Edison, Albert Einstein, so you must be knowing all these famous people, they had dyslexia, but they had a successful life. So you don't have to worry if you have a dyslexia. Okay, now come to the last topic of the neurodevelopmental disorder, that will be tic. So tic is involuntary movements and utterances, which is sudden, spasmodic and repetitive. So many of us, we face this, we have tic. This is a very common problem, and the commonly involved areas will be muscles of the eye. So some people go on twitching the eye, mouth, okay, smacking of the mouth, the giving some facial expressions, and there is a neck. Sometimes they just try to move the neck suddenly. Okay, so these are the areas involved commonly. And then they have motor expressions. So the examples will be blinking of the eyes, facial twitching, And then vocal examples. Some people, they do go on clearing the throat. Okay, so that is also part of tic. And then obsessed gestures and vocalizations they might have, and even corporelia they might have. Corporelia is a involuntary. In corporelia, a individual says involuntary, he says some socially inappropriate or offensive words. Mainly it is curse words or some slurs that is offensive and disrespectful to the people. And then sometimes they use offensive words, some vulgar language, abusive expressions in the public also, because it is occurring involuntarily, that is not their fault. Tics most commonly occur in school-age children. Prevalence of tic is 1 to 2%. Male to female prevalence is 2:1. It occurs by 2:1 ratio. In male, it is 2 times more common than the female. Now come to the classification of tic. It can be of 3 types: transient, chronic, and Tourette syndrome. Transient is, it is very mild, occurs several times in a day, and it lasts or persists for 4 weeks, that is 1 month till 12 months. So 1 month to 1 year it may persist and then it disappears. And there is chronic form of tic that is rare. So chronic is when it is persisting for more than 1 year. So here motor as well as vocal tic can occur. It may occur daily or intermittently for more than a year, and sometimes it may persist till adulthood. You can see some adult people also shrugging the shoulder or clearing the throat repeatedly. So those are chronic tics. And another is Tourette syndrome, that is a severe form of tic. Tourette syndrome, it begins very early in the childhood with a simple action like blinking of the eyes, smacking of the face. Later it has a complex motor activity like suddenly squatting while walking. A child is walking and suddenly he squats, and this is followed after 1 to 2 years by the vocal tics, leading to grunting, barking or corporelia. So they start using offensive words once it becomes chronic. So treatment of tic, if it is a mild tic, it does not require any treatment. It goes away with time. Only thing is you should not notice and you will not tell the child not to do that. If you notice and tell the child not to do those actions, that persists for longer time. So you just ignore, the tic will improve. But in case of Tourette syndrome, which is a very severe form of tic, they require treatment with a dopaminergic antagonist like haloperidol, and sometimes they even require atypical antipsychotics like quetiapine. So this is going to help them to decrease the symptoms. Okay, thank you. So I've completed the neuro developmental disorders. So next class I'll come up with another topic in pediatrics. Thank you. If you feel my class is helping you, don't forget to subscribe, like and share. Thank you.